My background is interventional cardiology, and I practiced interventional cardiology for about 25 years in Texas. Co-founded a heart hospital and built a heart group, and did a lot of things in the interventional space. I got very interested in heart attack and stroke prevention, actually, and also got very interested in health optimization. How do you help people turn back the clock? How do you help people answer the question, how good can I be, and how fit, and how strong, and for how many years and decades forward can I carry that? One of the areas that we're working in, being a cardiologist, of course, I wanted to look and see what it might do for the cardiac rehab population. And so we initiated an IRB-approved study, which is still ongoing, to look at cardiac rehab patients and compare it, Vasper rehab to traditional rehab, and see who gets the better outcomes with regards to improved cardiac function, sense of well-being, different lab tests that we're measuring. And so we've been quite pleased with that so far. In the context of doing that study, we started to notice that people with congestive heart failure were actually improving more than we anticipated. And so that became very exciting to us. And so we've done a number of things with a few congestive heart failure patients utilizing Vasper protocols, and we've seen really quite dramatic results. So we're in the process right now of pursuing additional studies, if you will, in that patient population of congestive heart failure. So we've also been able to do a safety study and been able to demonstrate that use of Vasper is safe for the general public and for cardiac patients, that it doesn't really cause untoward problems. It's really kind of falls in line with the risks/benefits of any form of exercise, if you will. The other thing that really intrigued me is that not only is it applicable to the cardiac population, but we've seen great results in people that have undergone surgeries or had an injury, need for recovery. It seems to work incredibly well in the physical therapy space. And the physiology of Vasper is complex. I think there are systemic effects, some of which are hormonally mediated. There are local effects on the muscle and vasculature, and the compilation of all those things basically seems to really accelerate healing. So we find that when people do Vasper prior to a surgery, they recover faster after the surgery. And likewise, people that have had a surgery, they seem to recover quite a bit faster when they do Vasper as part of their recovery program. So that's been very exciting for us as well. We know that exercise in general will improve insulin sensitivity. That's a well-known fact. There's a study going on right now in Hawaii that's demonstrating exaggerated benefits to the use of Vasper over what would be anticipated with traditional exercise. So again, it's a little bit, you can think of Vasper in terms of, it's like exercise that's turbocharged. The benefits of exercise, but it's turbocharged. And the beauty of it is that it's accessible to populations that wouldn't be able to access the level of exercise required to gain those benefits. So by utilizing compression and cooling, we can actually have people exercise at a low level and still get these augmented gains in terms of exercise response. So I think working with the diabetic population and seeing greater improvements in blood sugar than we would otherwise anticipate it is due to the fact that they're utilizing the Vasper technique. So I think that utilizing Vasper in more patient populations, like the Parkinson's patient group, people that have other disabilities, people that are trying to reclaim their strength after more debilitating injuries. I think that's a great population to work in. We've been having conversations with oncologists in Texas around whether or not we can use Vasper for oncology patients, because it's well known that cancer patients improve with exercise, and we'd like to show that they could improve even more with Vasper.